Just a warning, some of the video in this next story may be a little disturbing, so if you are a little squeamish about blood, you might not want to watch. 14-year-old Twinkle is a typical teenager in every way except one. She suffers from a mysterious condition which makes her spontaneously bleed from her eyes, hands, and head. Her story is being told in a new special that will air this weekend on the National Geographic Channel. Dr. George Buchanan is a pediatrician at the University of Texas Southwestern and Children's Medical Center in Dallas. He's met Twinkle. So, Dr. Buchanan, good to see you.
Thank you.
So, this is a very unusual story. A young girl, you have 30 years of experience. You've treated kids for anemias and blood disorders. Have you ever seen anything like this?
Nothing like this before. This is really a first for me.
Now, what's the simplest, easiest way to describe Twinkle's condition?
Well, she's basically a healthy young lady, other than for the past 2 or 3 years she's had episodes of bleeding seemingly from her eyes and her scalp and hands and feet that just come on a couple times a week. No one really understands why.
Where's the bleeding, where's the blood coming from?
Well, that's a very good question. When one looks at her, there's no obvious cuts or scrapes or scratches or wounds. This seems to come right through the skin and from the eyes, and medical science just doesn't have a good explanation for that.
Does this cause her pain?
She complains of mild pain from time to time, but it doesn't seem to cause a lot of pain.
Now, and how was this condition discovered? How old was she when this started?
She was about 11 to 11 and a half when it began.
Now, we see her, you here examining her, and we should note you weren't there when the bleeding actually started.
I wasn't, and that's really critically important. In fact, no one other than perhaps the mother a time or two has actually seen the bleeding begin. It's the aftermath of the bleeding. That's when I saw her. It had already happened.
So what does that say to you? What is that a clue?
Well, it's a clue that first of all, there's no mechanism by which blood can spontaneously come through the skin and from the eyes that medical science understands. So this really does raise the question that this is being faked in some way, or the blood is being placed there or put there by Twinkle.
In fact, I was going to ask you, now, you traveled to India to conduct your own testing for this documentary that's going to be on National Geographic. So what are your thoughts?
Well, when I heard her story, even before I left, it sounded very suspicious to me in that I had not seen bleeding conditions like this before. I've seen many, many children with bleeding conditions, and the doctors in India suspected that as well. The family weren't willing to accept that diagnosis, however.
Now, so the obvious question, is this a hoax, do you think?
Well, it could well be. Whether a definition of a hoax, I guess. Yes, I think this is something that's been purposely brought on. That is the most likely diagnosis. There's a term called Munchausen syndrome, which is used broadly to define a situation where a person, a patient, brings on illness, induces injury to themselves for a variety of reasons.
But at this point, after examining her, you can't tell how.
I can't tell how. I don't know where the blood comes from. We did an extensive evaluation, which is shown in the documentary, to try to determine. It seems to be her blood, but where it's coming from is unclear.
Do you think her mother's involved in this at all?
I think it's possible. Again, it's not totally clear, but I think there's a good reason to think that she probably is.
And what happens to Twinkle going on from here, do you think?
Well, I don't know. I feel bad for her. This really has affected her life in a major way, and it would be nice to have a definitive diagnosis and be able to offer her treatment. But I really think it's a psychiatric problem, really more than a blood problem.
All right. Dr. George Buchanan, thanks so much.